Well, welcome everybody to the National Eating Disorders Collaboration meeting for February. I particularly want to acknowledge you, Beth Shelton, but all of the researchers, the practitioners, the advocates, the carers, those with lived experience who are here today. I'm sorry I can't be with you in person, but I'm absolutely with you in spirit. This is, as it is for all of you, a deep personal passion. We know the cases, the agonising stories, the impact on families, and we know that 1 million Australians suffer from some form of eating disorder, and that of those, up to 30% can have long-term conditions which need to be managed, which can be utterly debilitating, and which sadly, as you know all too well, can lead to the highest mortality rate of any of the mental health conditions. So this is a major national challenge, and it's one which, with your help, we've tried to bring into the light. There's more work to do on that, but big and powerful things have happened together over the last 2.5 years. In particular, we've been able to change the Medicare profile and allow for a specific Medicare treatment. Up to 60 different consultations as a result of the work which went before the Medicare Task Force, your submissions, your leadership, and this outcome that helps patients. And yes, it's over $110 million, but it's not that. It's the hope, the ability, the support, and the model of tailored treatment right across the health system, which matters for patients with eating disorders. It matters for the families of those with eating disorders, but it says something right across the mental health sector and the different forms of mental health conditions, because these are very different conditions and should no longer be just lumped in as one. And you're the ones that have told us that, and I want to thank you and honour you for that. In addition, dedicated eating disorder treatment centres funded with $63 million in all of the states and territories. And that's a really powerful thing. It won't solve everything, but it's a very important step forward. It adds to the Medicare sessions with the live-in treatment, which will be the model in some places, and each state and territory will work with us, and many of you will be involved in this, in defining the appropriate model. All of these things matter. And then we come to the deep research task. It was no random choice that eating disorders was chosen specifically as one of the first priority areas for the $125 million Million Minds Mental Health Mission under the Medical Research Future Fund. As part of that, the first $5 million has been allocated, shared in different projects between Sydney University and Deakin University. These are important projects inquiring into the pathology, the treatment, and the pathway forward for those who are suffering from and battling eating disorders. And then, of course, $4 million for Inside Out to assist with their groundbreaking leadership and research and bringing together people from around the country. So it's always a difficult condition, but the light which we talked about together 2.5 years ago is now increasingly being shone on eating disorders. The support which you said was needed is being provided, and the research which will help us chart a pathway to understanding the origins and the pathology, and therefore the optimal treatment and both prevention and recovery, is underway. There's more. There's always more to be done, and your task is to help lay out those steps, to work with myself and my team on that. But so long as you're there, I'm here and working with you on what I believe is a profoundly important but utterly achievable national task. I thank you and I honour you.